Well, Thursdays aside, we set aside the time to talk with people from the medical community today. Dr. Borden Hooks is here from New Hanover Regional Medical Center, a general surgery specialist there. Will be talking to us about hernias. We've been kind of talking off cameras. I'll share the personal information. I've had two, both of those when I was young, so I was asking you if you see them more at a certain age, but you're saying across the board, it's a really common occurrence.
Well, across the board, and the hernia you're speaking of are inguinal hernias. They're very common. They can pop up in newborns, in which case they're fixed primarily, and then throughout the spectrum of your life they can reoccur. Men generally have about a 25% incidence of hernias in the groin area, whereas women only have about a 3% occurrence risk.
And as we were speaking and what I was reading too, you can have one of these, and unfortunately so many people will have them and choose not to have them fixed.
Well, sure, there's a lot of data out there that says that you can do watchful waiting on hernias, which is absolutely true. The problem with a hernia is that it's never going to go away. And as in with most things, if you can fix a hernia when it's small, it's generally a lot easier. If you wait till the hernia is very large and you're having problems with it, then obviously the recovery becomes much bigger.
What brings these on?
Well, most of the time it's a natural defect in your abdominal wall. They occur in the groins because of where the testicles descend when you're a boy. They form around the belly button where the umbilical cord used to attach. And then certainly other big common ones is if you've had surgery anywhere, you can get an incisional hernia. And that's obviously from where things didn't heal well from the original procedure.
Because it is your practice, if you do opt for the surgery, I was saying my scars are, about 4 inches long, but that is no longer the case.
Well, a lot of it just depends on the surgical approach. It depends on the type of hernia, but generally we're offering more and more minimally invasive type surgeries. We're using the Da Vinci robotic system, which we can use small incisions and place mesh in very difficult positions to reach. Open hernias are often a very good repair as well, but it's really up to you and your surgeon to decide what procedure is going to work best for you.
And we always say that if you do have a question about this or think that maybe you have a hernia, you want to look into it, always contact the doctor. Don't call us at the TV station. He's got a white jacket.
He's an expert.
Yeah,
he's an experienced expert.
I may have been there, but he's the one that'll be there with the instruments. Doctor, I appreciate the time.
Thanks for the time.
Thank you very much.